Okay. So, Assalamualaikum
Mm.
and good morning, everyone. Today, I am with my partner. We'll present to you guys about the effect of our work for staff in healthcare. So, before that, I will introduce ourselves to you guys. So, my name is Muhammad Hazim bin Ramli, and so my partner here is Muhammad Irfan bin Ibrahim. Okay. So, when we think of healthcare, we often think of the patient being safe. But today, we want to shift the spotlight to the savior themselves, which means the doctor, nurse, and the medical assistant who are running on empty. So, Faris, could you guide us through our objectives of this reporting?
Okay. Okay. So thank you, Hazim. So first of all, our presentation today has two primary objectives, which is the first one is we want to compare the prevalence of burnout across the different categories of medical professionals. Second, we aim to identify and illustrate the primary organizational stresses that push our healthcare worker to their limits. So, Hazim.
So, to build a foundation for this topic, let's look at the effect of role overload. When a medical professional is overworked, it doesn't just mean they are tired. It also triggered their deep psychological distress. When a human being is emotionally and physically exhausted, their function is slowed down. In medical women, this can affect the quality of patient care, also leading to medical error and slower response time and also the drop in empathy. This is the central idea of our report today. So now to give you guys about some of background on why this topic is mean so much to me is this issue hit incredibly close to home because personally I have witnessed brutality brutality of heavy medical workload through the living experience of my own sister and my aunt. Both of them is work as a nurse and also as a doctor in the Malaysia. So I have seen them come home after lunch and long shift and they become a very tired and also cannot do another job at home. So this has made me realize that workload overload can be affect them very heavily. So next, okay, next. Okay, so to back up this observation with concrete evidence, let's analyze this. But the data is extract from a article that conducted by Zakaria, which investigate Malaysia emergency medical staff working under the extreme pressure of the COVID-19 pandemic. So if you direct your attention to the total summary column on the far right, out of 216 respondents, over half, specifically 51.3%, experience definitive burnout. But the real story lies in how this stress is diffused among population. Look at the data for nurse, they reported the highest overall burnout rate at massive 61.2%, and even more alarming the us, which means 21.8% of the nurse will experience what is qualified as a advanced burnout. If we compare this to doctor and assistant medical officer at the gap is very different and also is very undeniable. So why our nurse face this problem is the risk factor point to the fact that nurse has the most challenging which mean to face patient contact. They don't just consult and leave, they stay by the bedside. Furthermore, the study highlight two major systemic trigger across all staff category which mean unclear operational guideline and a low salary per patient. So when worker don't know what is expected of them and fear they are costed fairly, the burnout is very easy to come to them and affect them.
Okay, thank you, Hazim. So let's take a look at the analysis a step further and compare where the stress is mostly concentrated. This next chart compares where work-related stress metrics between the government and private healthcare sectors. So the primary finding here is undeniable. The heaviest burden of work-related stress is heavily concentrated in the government departments, in which that if you look closely at the metrics, while the job stress frequency is relatively similar in both sectors, government staff exhibit significantly higher in job stress severity and a higher overall stress index. What's even more alarming is that in this data is the support deficit, which is that there is a massive disparity regarding the lack of organizational support, which is that government workers are faring drastically worse here, which highlights a massive organizational failure in protecting our public frontline workers. So, in conclusion, that systemic workload is an exhausting reality that demands a multifaceted, urgent solution from all relevant stakeholders. We cannot expect our healthcare workers to keep pouring from an empty cup. To address this, we recommend two major interventions, which is that healthcare institutions must step up by implementing a regular training and emotional intelligence development workshops to actively strengthen workers' coping mechanism. Other than that is that government bodies must establish permanent institutionalized mental health support system to safeguard long-term welfare, ensuring job satisfaction and safety across all tiers of healthcare. This is to make sure that all the healthcare workers can work in a long-term view to make sure that they can provide more service in the future for the country and for the patients in a more effectively and efficiently. So that's all from us. Thank you.